Welcome to Muscle Research Review for the week of May 11th, 2015. Quick research summaries for the very busy health and fitness professional. So let's begin. If you prescribe side-lying hip abduction exercises for recruitment of deep trunk muscles, you might want to apply manual pelvic fixation. Now, this cross-sectional study found that the greatest activation was seen in the ipsilateral deep and superficial multifidus muscles with the manual pelvic fixation. If you're looking to detect weakness of neck extensors and differentiate between superficial and deep neck extensor muscles, the cervical extensor endurance test may be a good option. And the new study found that the inter-rater reliability was actually very good. The test involved placing a patient in a prone chin tuck position in neutral for about 20 seconds for evaluation. Deep neck extensor weakness can be seen by the chin length effect from neck extension, indicating dominance of the superficial neck extensors. Now, neck flexion, on the other hand, can point out both the superficial and deep neck extensor muscle weakness. The study notes that the accuracy of the test is still debatable, since it can't be compared to a diagnostic gold standard. However, it offers an initial sense of direction in clinical treatment strategies. A new study looked at the role of cartilage stress in patellofemoral pain. Between those with patellofemoral pain and the controls, they found that there was no difference in peak patellar strain density. But there was significant subject variation, with females showing more cartilage stress than males. It might explain the greater prevalence of patellofemoral pain in females, but the study states that there are other mechanical and biological factors that are involved. We continue with a systematic review of the effectiveness of exercise on recovery and clinical outcomes of soft tissue injuries of the lower extremity. Now, the study screened 7,946 articles, leading to an appraisal of 10 randomized controlled trials, with about 6 having a low-risk bias. Here's a summary of the key findings. For ankle sprains, immediate post-injury exercises are pretty much as effective as exercises initiated 1 week post-injury. Progressive exercises plus education and advice and home exercises had actually similar outcomes to just education advice and home exercises alone. For Achilles tendinopathy, eccentric exercises are more effective than an air heel brace, but less effective than acupuncture for a duration longer than 2 months. For plantar heel pain, static plantar fascia stretching provided short-term benefits. Interestingly enough, static stretching of the calf muscles had actually similar outcomes to sham ultrasound. Now, I've recently been getting questions from health and fitness professionals about the role of yoga in rehabilitation and training. So I decided to dig up an article from last year that looked at the core muscle function during specific yoga poses. Now, the study found the following correlation between pose and muscle strengthening. The high plank, low plank, and downward facing dog are effective at strengthening the external oblique abdominis muscle. The warrior one and chair are great for targeting the gluteus maximum. The chair and halfway lift poses can strengthen the longissimus thoracis. Now, the upward facing dog pose can target all 3 of these muscles. If your patients or clients participate in yoga in addition to your program, these poses may allow you to quickly integrate their yoga exercises into a rehabilitation or a training program. If you have any comments, leave them below. Also, make sure you subscribe to our YouTube channel for the latest weekly muscle research findings to keep you up to date. Thanks. We'll see you guys next time.